Peaks Tech Zone, we believe, is the first of its kind in Texas. We haven't seen any other pediatric location with a space like this.
The kinds of experiences that patients and families can have at Peaks Tech Zone are going to be varied. They can come in and they can get signed up on our patient portal. They can be shown everything that the portal has to offer so they can see that it's more than just immunization records and e-check-in.
I knew that if we could bring some really targeted education where people could learn about technology and use technology to make those parts of their life easier so that they could spend more time actually managing their child's care. That was what was really important to me to bring to this project, just because, you know, we're all about play here at Cook Children's, and so we have that element of just magic that I know is everywhere at Cook Children's. And then, of course, really targeted education about really innovative technology that's going to, we think, transform.
Well, when you think about the motivation behind creating the Peaks Tech Zone, I think it really goes to the overall strategy of the campus, which is to provide a comprehensive program for our families.
Some of the cool features in the Tech Zone, well, the wall behind me, that was just amazing. So while the parents are having a conversation with the health technology advocate, their children can come over here and have some fun distraction therapy coloring on that wall. We also have our technology vending machine. We have things like charger cables in there, pretty much just a wide variety of things that are we thought might be needed, especially as the medical center is built. When you have families who are here for much longer periods of time, we want to make sure that if their kids need distraction, they can come down here and acquire that distraction.
We want to remove barriers. We want to improve patient outcomes. Anytime a patient has a diagnosis that might require additional technology or equipment, it's our job to be able to pair them up with the right equipment and technology. We do have various glucometers on hand to start off, and hopefully other technology in the future. But the idea is that we can demo it for the parents and demo it for the kids and make sure that they are comfortable and confident when they leave here that the technology that they have is going to work best for them.
Our basic services, of course, are our portal education. So My Cook Children's, learning how to schedule an appointment, message their providers. So very specific education and demonstrations of what the portal looks like, how you can interact with it, is probably the one thing that we're going to get a lot of.
They can also sample a telemedicine visit. It can be a pretty big barrier for families if they've never done a video visit before because they don't know how. But in addition to that, there are a lot of pieces of health technology that patients are asked to acquire after a diagnosis. Rather than just having to go out and make a purchasing decision on their own, they can come here and they can see them all, they can touch them all, and they can see what the apps are like that support those devices.
You know, that's why we want to have a combination of our tech support, our clinical support, because we're all very focused on that child. So we want them to see it, to feel it, to touch it, so that when they do go home and they have to use it, they're not scared about it.
We want to make sure that the services that we offer are enriching, but most importantly, helpful. We want this to improve outcomes and experiences, and so we're going to make sure we're always chasing that target.